Comprehensive NCLEX RN Challenge Exam 13. Question 1. A 43-year-old African American male is admitted with sickle cell anemia. Which of the following outcome criteria would the nurse use to assess circulation in the lower extremities? Body temperature of 99 degrees Fahrenheit or less. Toes moved in active range of motion. Sensation reported when soles of feet are touched. Capillary refill of 3 seconds. Capillary refill is a direct assessment of peripheral tissue perfusion. In sickle cell anemia, vaso-occlusive crises can impair circulation, making refill time a critical metric. Question 2. A 30-year-old male is brought to the emergency department in sickle cell crisis. What is the best position for this client? Side-lying with knees flexed. Knee chest. High Fowlers with knees flexed. Semi-Fowlers with legs extended on the bed. Flexing the knees or hips during a sickle cell crisis can further impede already compromised blood flow. Keeping the legs extended helps maximize circulation. Question 3. A 25-year-old male is admitted in sickle cell crisis. Which of the following interventions would be of the highest priority? Taking hourly blood pressures with mechanical cuff. Encouraging fluid intake of at least 200 ml per hour. Position in high Fowlers with knee gap raised. Administering Tylenol as ordered. Hydration is the primary intervention for sickle cell crisis to reduce blood viscosity and prevent further sickling of red blood cells. Question 4. Which of the following foods would the nurse encourage the client in sickle cell crisis to eat to assist with recovery? Peaches, cottage cheese, popsicle, lima beans. Popsicles provide both comfort and much-needed hydration, which is essential for a patient in a vaso-occlusive crisis. Question 5. A client is complaining of severe pain in his feet and hands during a sickle cell crisis. The pulse oximetry is 92. Which intervention would be implemented first? Adjust the room temperature. Give a bolus of 4 fluids. Start O2. Administer meperidine, Demerol, 75 mg for push. Oxygenation is the priority, ABC, when the pulse oximeter shows hypoxia, 92%, and the patient is experiencing sickling, which is triggered by low oxygen. Question 6. The nurse is instructing a client with iron deficiency anemia on dietary choices. Which meal plan would the nurse expect the client to select? Roast beef, gelatin salad, green beans, and peach pie. Chicken salad sandwich, coleslaw, French fries, ice cream. Egg salad on wheat bread, carrot sticks, lettuce salad, raisin pie. Pork chop, creamed potatoes, corn, and coconut cake. Roast beef is a high source of heme iron, which is absorbed more efficiently by the body than non-heme sources. Question 7. The nurse is recommending activities for a client with sickle cell anemia to avoid hypoxia. Which activity is most appropriate? A family vacation in the Rocky Mountains. Chaperoning the local boys' club on a snow skiing trip. Traveling by airplane for business trips. A bus trip to the Museum of Natural History. High altitudes, mountains/plains, and extreme cold, skiing, can trigger a crisis. A low-altitude, indoor bus trip is the safest choice. Question 8. The nurse is conducting an admission assessment of a client with vitamin B12 deficiency. Which of the following would the nurse include in the physical assessment? Palpate the spleen. Take the blood pressure. Examine the feet for petechiae. Examine the tongue. Vitamin B12 deficiency, pernicious anemia, is often characterized by a smooth, beefy red tongue, known as glossitis. Question 9. An African American female is suspected of having vitamin B12 deficiency anemia. What body part would be the best indicator for jaundice? Conjunctiva of the eye, soles of the feet, roof of the mouth, shins. The hard palate, roof of the mouth, is one of the most reliable sites to assess for jaundice in individuals with dark skin. Question 10. The nurse is conducting a physical assessment on a client with anemia. Which clinical manifestation would be most indicative of the anemia? BP 146/88. Respirations 28 shallow. Weight gain of 10 pounds in 6 months. Pink complexion. Tachypnea, increased respiratory rate, is a compensatory mechanism used by the body to increase oxygen intake when hemoglobin is low. Question 11. The nurse is teaching a client with polycythemia vera about complication prevention. Which statement by the client indicates a need for further teaching? I will drink 500 ml of fluid or less each day. I will wear support hose when I am up. I will use an electric razor for shaving. I will eat foods low in iron. Clients with polycythemia vera should stay well hydrated, usually 3 liters/day, to decrease blood viscosity and prevent clot formation. Question 12. A 33-year-old male is being evaluated for possible acute leukemia. Which of the following would the nurse inquire about as part of the assessment? The client collects stamps as a hobby. The client recently lost his job as a postal worker. The client had radiation for treatment of Hodgkin's disease as a teenager. The client's brother had leukemia as a child. Previous exposure to radiation or chemotherapy, for other cancers like Hodgkin's, significantly increases the risk of developing acute leukemia later in life. Question 13. An African American client is admitted with acute leukemia. What is the best site for examining for the presence of petechiae? The abdomen, the thorax, the earlobes, the soles of the feet. In dark-skinned clients, petechiae are most easily observed in lighter areas such as the palms of the hands or the soles of the feet. Question 14. A client with acute leukemia is admitted to the oncology unit. Which of the following would be most important for the nurse to inquire? Have you noticed a change in sleeping habits recently? Have you had a respiratory infection in the last 6 months? Have you lost weight recently? Have you noticed changes in your alertness? Infection is a major cause of death in leukemia patients due to neutropenia. A history of recent infections can indicate a compromised immune system. Question 15. Which of the following would be the priority nursing diagnosis for the adult client with acute leukemia? Oral mucous membrane, altered related to chemotherapy. Risk for injury related to thrombocytopenia. Fatigue related to the disease process. Interrupted family processes. Thrombocytopenia puts the patient at extreme risk for spontaneous and life-threatening hemorrhage. Preventing injury and bleeding is the priority. Question 16. After the physician performs an amniotomy, the nurse's first action should be to assess the degree of cervical dilation, fetal heart tones, client's vital signs, client's level of discomfort. The priority after the membrane's rupture, amniotomy, is assessing fetal heart tones to ensure the umbilical cord hasn't prolapsed. Question 17. A vaginal exam determines that the client's cervix is 5 cm dilated with 75% effacement. The client is in which phase of labor? Active, latent, transition, early. The active phase of the first stage of labor is typically defined by cervical dilation between 4 and 7 cm. Question 18. A newborn with narcotic abstinence syndrome is admitted. Nursing care of the newborn should include teaching the mother to provide tactile stimulation, wrapping the newborn snugly in a blanket, placing the newborn in the infant seat, initiating an early infant stimulation program. Newborns experiencing withdrawal should be kept in a low-stimulation environment. Swaddling snugly helps provide comfort and reduces irritability. Question 19. Following the initiation of epidural anesthesia, the nurse should give priority to checking for cervical dilation, placing the client in a supine position, checking the client's blood pressure, obtaining a fetal heart rate. Maternal hypotension is a common side effect of epidural anesthesia, which can lead to decreased placental perfusion. Question 20. The nurse is aware that the best way to prevent postoperative wound infection in the surgical client is to administer a prescribed antibiotic, wash her hands for 2 minutes before care, wear a mask when providing care, ask the client to cover her mouth when she coughs. Hand hygiene is the single most effective method for preventing the spread of infection and protecting surgical wounds. Question 21. The elderly client is admitted to the emergency room with a suspected fractured hip. Which symptom is the client most likely to exhibit? Pain, misalignment, cool extremity, absence of pedal pulses. A classic sign of a hip fracture is the shortening and external rotation of the affected leg, misalignment. Question 22. The nurse knows that a 60-year-old female client's susceptibility to osteoporosis is most likely related to lack of exercise, hormonal disturbances, lack of calcium, genetic predisposition. The decrease in estrogen production following menopause is the leading cause of bone density loss in postmenopausal women. Question 23. A 2-year-old is in Bryant's traction for a fractured femur. Which finding indicates the traction is working properly? The infant no longer complains of pain. The buttocks are 15 degrees off the bed. The legs are suspended in the traction. The pins are secured within the pulley. In Bryant's traction, the buttocks must be slightly elevated off the mattress to provide the necessary countertraction. Question 24. Which statement is true regarding balanced skeletal traction? Utilizes a Steinman pin, requires that both legs be secured, utilizes Kirschner wires, is used primarily to heal the fractured hips. Skeletal traction involves the use of pins, like Steinman pins, or wires inserted directly into the bone for long-term immobilization. Question 25. Immediately following surgery for an open reduction internal fixation of a fractured hip, the nurse should give priority to assessing serum collection, Davol, drain, client's pain, nutritional status, immobilizer. Monitoring for excessive drainage or hemorrhage from the surgical site is the immediate post-operative priority. Question 26. Which statement by a family member indicates an understanding of the nurse's teaching regarding a percutaneous gastrostomy tube? I must flush the tube with water after feedings and clamp the tube. I must check placement 4 times per day. I will report to the doctor any signs of indigestion. If my father is unable to swallow, I will discontinue the feeding. Flushing the tube after feeding prevents clogging, and clamping the tube prevents the backflow of gastric contents. Question 27. A client is 2 hours post-total knee replacement. Which information requires notification of the doctor? Bleeding on the dressing is 3 centimeters in diameter. The client has a temperature of 100.6 degrees Fahrenheit, 38.1 degrees Celsius. The client's hematocrit is 26%. The urinary output has been 60 during the last 2 hours. A hematocrit of 26% is significantly low, suggesting substantial blood loss during or after surgery that may require a transfusion. Question 28. The nurse is caring for a client with a 5-year-old diagnosis of plumbism. Which history is most likely related? The client has traveled out of the country in the last 6 months. The client's parents are skilled stained glass artists. The client lives in a house built in the 1970s. The client has several brothers and sisters. Lead, plumbism, is used in the soldering process of stained glass. If parents are artists, the child may have been exposed to lead dust or fumes. Question 29. Which equipment would assist the client with a total hip replacement with activities of daily living? High seat commode, recliner, TENS unit, abduction pillow. A high seat commode prevents the hip from flexing more than 90 degrees, which is a critical precaution to prevent prosthesis dislocation. Question 30. In anticipation of complications from anesthesia and narcotics in an elderly surgical client, the nurse should administer oxygen via nasal cannula, Have Narcan, naloxone, available. Prepare to administer blood products. Prepare to do cardio resuscitation. Elderly patients are at higher risk for respiratory depression from narcotics. Naloxone, Narcan, should be readily available as an antidote.